Join us August 21st for this month's Lunch and Learn with the Link, focusing on chronic GVHD of the skin. Our guests will be Dr. Rachel Rosenstein of the Hackensack Meridian School of Medicine and Ann Fitzpatrick, an MDS survivor. This free webinar will be Wednesday, August 21st at noon Eastern. To register, visit nbmtlink.org or follow the link in our show notes. Welcome to Season 14 of the Marrow Masters podcast, brought to you by the National Bone Marrow Transplant Link and sponsored by Insight and Syndax. The National Bone Marrow Transplant Link, established in 1992, strives to help patients, caregivers, and families cope with the psychosocial challenges of bone marrow and stem cell transplant, from diagnosis through survivorship. This season focuses on chronic graft versus host disease, or GVHD. We'll cover male and female sexuality, the emotional struggles of the disease, and even atypical presentations of GVHD from the perspectives of patients, caregivers, and medical professionals. Here's your host, Executive Director of the NBMT Link, Peggy Burkhardt.
Hello, everyone. So today we have with us Dr. Hermi Amonoo, Carol C. Nadelson, MD, Endowed Chair in Psychiatry, Director of the Wellbeing and Cancer Research Program at Brigham and Women's Hospital, and Associate Professor at Harvard Medical School. Welcome.
Thank you so much, Peggy. I'm really excited to be here today. Thank you.
Well, very good. Let's get started. So we appreciate your time, and we're really looking forward to talking to you today about the many psychosocial considerations when it comes to graft versus host disease after a bone marrow stem cell transplant. Dr. Amonoo, can you share more with us about the distress symptoms relevant to GVHD?
Absolutely. So when we think about psychological distress in patients who are managing graft versus host disease or GVHD, so a lot of these patients, before they have to manage GVHD, have had to manage cancer. They've had to manage having a stem cell transplant. And about 50% of patients living with GVHD report clinically significant symptoms of distress, specifically depression. Approximately a third also reports clinically significant symptoms of anxiety. Unfortunately, patients who report moderate to severe chronic GVHD and those who are more likely to take medications for pain, anxiety, or depression report some of our worst symptoms. So it's not uncommon to see a significant proportion of our patients grappling with different psychological distress symptoms as they manage everything else they have to live with pertaining to their GVHD.
And I think about it, they made it through the transplant, they beat the cancer, things should just be wonderful now, and here's the graft versus host disease finding its way into their lives. We're going to talk a lot today about different ways to cope with it, but how does this distress affect daily life?
So psychological distress has a way of permeating different aspects of people's lives. When we think about even mundane things like daily routines, it can really get in the way of people sometimes wanting to just get out of bed and go about their business to do things that they find meaningful. Unfortunately, psychological distress can also impact different important relationships and social roles that patients may have. So this can start at the home. Sometimes it can disrupt how people relate with their own family. And definitely, if someone works outside the home, it could also impact work relationships. It could impact, social relationships and different social roles that people have. Mm-hmm. And because of that, having and managing distress can worsen loneliness, which is like the chicken versus the egg, because being lonely in and of itself and having limited social interaction can also worsen distress. So when we think about how GVHD in and of itself and distress affects daily life, it becomes like a double wheel, right? Mm-hmm. GVHD in itself is compromising what people can't do when it comes to like living a meaningful life and thriving. And then when you add psychological distress on top of that, it can even make things worse for patients.
Absolutely. So Dr. Amonoo, you mentioned to me that psychological well-being can be seen as a toolbox. I really love this analogy. Let's break that down.
So when I usually get called to take care of patients who are navigating blood cancers or frankly any cancer in general, and certainly those who are managing GVHD. Like I'm trained as a psychiatrist and also in psychosocial oncology specifically. So a lot of my work really entails being invited to help patients navigate distress and how to be as well as possible. And usually when I walk into a patient's room, the first thing I ask myself is, who is this person? Like, who is this human being in front of me? And, who else is in their lives and how are they managing everything that they are navigating with their illness and, pretty significant side effects like GVHD. And then when I think about well-being, there are various ways of thinking about it. So sometimes you can help patients attain well-being by taking away distress, which is things like anxiety and depression or post-traumatic stress symptoms that's undermining distress. But you can also think about well-being as what are the things in an individual's lives, things that bring meaning and optimism and gratitude and joy that accentuates well-being. And for a lot of individuals, I like to think about it as like a toolbox. I am not a craftsman by any means, but I know a lot of people who do. In any average toolbox, there are different tools and equipment that are really essential to make the toolbox effective. And I think our well-being is like that. And so when I think about the psychological well-being toolbox, what exactly is in that? Mm-hmm. So there are different psychotherapeutic interventions and skills that one could learn to help you navigate and manage the stress or even reflect on experiences and things that pertain to meaning. There are also health behaviors that people could do, such as paying attention to your diet, eating well. There's a lot of evidence that health behaviors like good physical activity and sleeping well are also critical, which enhances well-being. And then there are also, for some people who, depending on their level of mental suffering, would need medications. And it is an important part of some people's toolbox as well. And then there are different kinds of professional help that one can pursue that could also help enhance your toolbox, whether it's seeing a specialty mental health clinician like myself or a social worker or a therapist. There are some individuals that's like a really critical aspect of their toolbox to learn the skills that they need to thrive. Another important component of your toolbox when I think about well-being is your social support and maintaining healthy relationships. Mm-hmm. Sometimes I tell the grandparents that I work with that, the best antidepressant that I have would not replace the joy that a grandchild would bring to you.
Oh, I love that.
So even if you are taking medications for whatever, you can't underestimate how important and meaningful relationships contribute to your well-being. And for some people, peer support is also really critical, right?
Absolutely.
Having the opportunity to connect with others who have walked the path, who can share their lived experiences and different tips that they have used to thrive in the midst of everything that you are navigating can also really contribute to a well-being toolbox. And so, as you can tell, there are potentially different components. When I think about like the toolbox of the pie, the individual components, one is not better than the other. And I think it's helpful to think holistically about how to enhance different components based on your values and things that are important to you to have as robust a toolbox as you can possibly have.
Oh, I love this. This is so important. We have a peer support program at the National Bone Marrow Transplant Link, and we invite people to reach out to us. We have other mentors and experienced survivors and caregivers that are just, we have this one guy, he is just waiting and hoping for calls. So I'm glad you mentioned that. And also, the social support. There are several Facebook groups. One in particular, I think it's called GVHD Upside Down. Jody Nelk is the administrator, and I'd be happy to put that in the show notes. It is on the daily that people can find comfort through the comments of other survivors who are experiencing many of the same things. So thank you for that.
Yeah, and it's also wonderful to hear about your organization's efforts to assemble some of these resources for patients, because sometimes it's not always easy for people to know where to go. And it can get very overwhelming, especially if you don't know anyone in your immediate circle that's navigating some of these things. So thank you.
I'd also like to mention Elephants and Tea for the younger set. It's an incredible digital magazine. They really cater to young people connecting with other young people, and it's pretty unfiltered. One of our other podcasters this season is the founder of it, Angie, and she goes into more detail if anyone's interested in listening to that. She's the caregiver for her son, Stephen. So let's get back on track here. So Dr. Amonoo, why is your clinical team so important regarding the manifestation of this rare disease?
Absolutely. So the clinical team is really critical for several reasons. First of all, the clinical team can help you understand how GVHD manifests and the nuances of the diversity of symptoms that you can look out for, right? For a lot of people, the disease in and of itself evolves, right? As you may know, GVHD can impact different organs. It doesn't always happen at the same time. And so really working with your clinical team, asking questions, can help you learn. And sometimes the whole family learn about what this whole disease is about. The clinical team can also help you with different approaches and resources for managing the symptoms. Again, because it can be a multi-organ situation, you may need different doctors with different expertise to navigate the symptoms, and your clinical team can be the point to help you navigate who else you need to bring as part of the team to help you manage the symptoms. The team can also connect you with resources which are local to your institution where you are getting care or in the community. And as Peggy mentioned, there are a lot of community resources which you may not know about to navigate, whether it's your physical symptoms or psychological symptoms that, sometimes the social workers are very knowledgeable, or even your oncologist may be privy to some information in the community or even learning from other patients that they can share with you. So when you think about your clinical team, my hope is that you would think about them as partners and allies in navigating the different symptoms that can accompany GVHD. And I know sometimes people can be shy and they don't want to bother their clinicians and they don't want to appear unintelligent. And there are a whole host of reasons that sometimes people don't speak up. But I could tell you as a clinician that I always encourage my patients to not worry alone.
Yes.
There is so much that we can help you if we have a good understanding of what's going on. And although you may not know a lot about the disease in and of itself, usually patients are the experts of their bodies and understand what's happening when they are paying attention. And so you play a really critical role in this partnership to help you navigate the different symptoms that you have to manage and grapple with pertaining to GVHD.
I'd like you to reassure people too that, they get home. The GVHD often comes, months after they're home. They're no longer a patient of the hospital. So I think it's important to note that they're not being a bother by reaching out to your center. This is what you want. I think this is such important messaging.
Absolutely. And again, as I said, people hold back for multiple reasons, and it is a lot. I'll be the first to admit that it is a lot of information that you have to navigate on this journey. And, our patients hold a lot of gratitude for everyone that's helped them. And sometimes patients have this perspective that they don't want to be a bother. They don't want to be perceived as that person who is asking too many questions. But that should never be the case, right? Because again, as I said, most people know more about their bodies and what feels right and what doesn't feel right. And being able to communicate with your clinical team about that is really critical for them to stay on top of what's happening with you, especially because the symptoms can evolve, and to help you or direct you to the right people that can help you manage the symptoms. So never hesitate. I always tell my patients, have a low threshold to reach out with questions or share about symptoms that are new, because the sooner we know, sometimes our options for helping you manage them are more. And I think it's really important to not lose your voice in the midst of that, or even talking with family. Sometimes it is helpful to also even keep like a notepad or some kind of way of recording things as they're happening, because it can also help when you're sitting in front of your doctor to feel like you have things organized in a way that you can talk about them. But I 100% agree with you that people should not be shy or feel bad or worry about their reputation when they are reaching out and asking about what's going on.
Terrific. Thank you for that. Let's talk more about why it is so important with GVHD to pace yourself. We hear it again and again. Just people that overshoot it, they can't get out of bed for days. Let's talk about that.
So as I alluded to earlier, when it comes to things like GVHD, it's not a static condition, right? It's not, okay, this is what GVHD is going to be for you, and then that's it. The process can evolve over time for any given individual. So it's really important to give yourself grace to learn how this condition is manifesting in your body, to be patient with yourself, and again, partner with your clinical team to help you understand what this looks like for you and what the resources are. And to your point about sometimes people just can't get out of bed, it brings to mind how we think about even things like fatigue, which is really common in this population. So what typically happens is someone feels like they've missed a few days. And so when they have energy, they try to make up for lost time.
Yes.
And we all have the tendency to do that. But what we know is if you don't pace yourself and you try to do everything that you haven't been able to do all week, you are more likely to wear yourself out even quicker, to sort of like perpetuate like a vicious cycle, versus thinking about your amount of energy into like little aliquots where you want to keep at a pace that is sustainable. I think is really important. And I see it also like running a marathon. And the only difference about running this marathon is, unlike real marathons, you run alone. But in this case, you are not actually running alone. You have your whole clinical team. You have different loved ones who are alongside of you. And like any marathon, you have to pace yourself. It's not a sprint by any means. And I think it's really important to understand how much of a long haul or a journey this can be, and giving yourself grace and self-compassion is really important.
Oh, I love this. We had a gentleman one time on a program. I always think about this, and I think about it in my own life. He said, I pretend that my body is a fully charged cell phone in the morning and that it is going to run out by dinner time. So how am I going to spend my day to make sure there's something left at dinner time?
Absolutely.
I find in my own life, I try to remember that. So I hear what you're saying and I appreciate it.
Yeah, it's almost like not saving the leftovers for yourself, right?
Yeah.
You give so much. Most people's activities pertain to doing things for other people such that, they become so replete that there is nothing left other than exhaustion.
Yes.
And I think, when we think about pacing, sometimes it's also really important to educate the people around us. As we gain more knowledge about the manifestations of the disease and how it impacts energy and fatigue levels, finding the courage to share with loved ones can also be helpful, because they can also hold us accountable when it comes to pacing ourselves. Because when they don't understand what's going on, it can be really difficult. Let's say you have a couple where the spouse, who is the caregiver, is like, why aren't we moving? Like, let's get going. But they really don't understand that perhaps this person is not in the place today to do that. And so I think there is also an important component of making sure that the people around us understand the importance of keeping at a good pace.
Yes. And it makes me think too, when people will say, you look good, you got through the cancer. Why are you so tired? Why are you this? And I think it's important for people to remember, just because you look like yourself again, you may not be feeling the best yet. And having people that love you understand that.
Absolutely.
Getting back on track at your pace. And also the flexibility with friends, having friends. We interviewed a woman a few seasons ago where, she was tired at dinner time, but hey, what if somebody invited you to breakfast instead of dinner? And she goes, that would be really great. I have a lot of energy in the morning. So really helping your friends to understand how you need to flex on this, I think is helpful.
Absolutely.
So let's talk about caregivers. Oh, so important, aren't they?
They are.
What their role is, and really they need to give themselves some grace as well, right?
Absolutely. And we always say that caregivers are right on the front lines with patients, and how a lot of cancer care is even evolving. Some of them are even on the front lines of doing and caring for patients outside the hospital. And we know that for patients who have received a stem cell transplant or a bone marrow transplant, caregiver burden is high.
Mm-hmm.
Our patients for a long time lean on their caregivers to pretty much get through up until now.
Yes.
And I think it's also important to acknowledge the fact that relationships evolve over the course of managing, whether it's the cancer or the transplant recovery and even GVHD in and of itself. And one thing that I have observed very clearly in my clinical work is that most people and their loved ones are trying to take care of each other. So patients are trying to take care of their caregivers. Caregivers are taking care of each other. And even when patients are very ill, in their own ways, try to even take care of their loved ones. And I think the key is to communicate well with people around you. And this is for the caregivers as well. When things are overwhelming, to speak up and reach out for help. And sometimes we have to remind our caregivers that taking care of themselves is not a selfish endeavor, because we actually have research that shows that caregiver well-being impacts patients' well-being. And so a caregiver taking care of themselves is actually indirectly impacting patients' well-being. And so really encouraging our caregivers to make time, just like the saying goes, you have to put on your own oxygen mask before you can help others. It's really applicable in this case as well, that they really cannot afford for themselves and for their loved ones to let their own self-care fall by the wayside.
Oh, so true. Let me ask you this. Do you have any advice for when, say a husband is a caregiver to a wife or vice versa, and then they get through everything, and then they're trying to get back on track with the relationship as a husband and wife after it really changed for a while? Do you have any pearls of wisdom on that for us?
It's a common thing that comes up a lot, because understanding how the relationship evolves over time and where it lands, right? Because what a person can and cannot do, towards the end of the journey, in some ways is very different. And the key thing with where a person lands is also that sometimes values and priorities and things that are meaningful also evolve over the course of the recovery journey. So something that used to be very important for, let's say their husband may not be the case anymore after their experience, recovering. And so I think the key thing is communicating with each other, and then also not being shy to seek help. Social workers are on the front lines in most centers in terms of really supporting patients and their caregivers when it comes to their relationship and even getting back on track, where back on track could mean completely different things for different people. But I think it's really helpful to seek help if things are really not going in the direction that one would hope. And then I think it's also important to take things slow. I think it's almost impossible to pick up exactly where one left off from, when you stepped on this road of getting this treatment and recovery. And seeing this new season, of their relationship as just that, and in some ways as an adventure, and maintaining a lot of grace and patience with each other. And then also being curious, right? Because sometimes some of these diseases and treatments change us in ways that we may not even be aware of, right? And so I think there's a lot to understanding that this is a new normal in many ways, and maintaining a place of curiosity and humility can help you navigate, some of the changes that may not have been anticipated or expected.
So as we wrap things up, are there any last pearls that you would like to share with listeners today?
So thank you so much again, Peggy. I would say my last pearl would be to just remind people that don't worry alone when it comes to navigating this potentially difficult aspects of your recovery. Lean on your clinical team and your support networks to navigate the usually evolving nature of the challenges along the way.
Oh, great advice. Thank you so very much. Well, we are wrapping it up now, and I thank you for your time and your wonderful knowledge. And I know this is going to make a difference for so many of our caregivers and their loved ones.
Thank you so much again, Peggy. I would also like to thank the National Bone Marrow Transplant Link for this really wonderful opportunity to share some insights today from my clinical work and the real privilege it has been to take care and work with this population. I also hope that our conversation has empowered patients and their loved ones and caregivers in their recovery journey. And I wish everyone well.
This has been the Marrow Masters podcast. If you know someone who would benefit from the information in our show, please share this episode with them. And don't miss future episodes of our show. Follow Marrow Masters for free on Apple Podcasts, Spotify, YouTube, or wherever you're listening right now. And to connect with the National Bone Marrow Transplant Link, visit nbmtlink.org or tap the link in our show notes.